May is National Stroke Awareness Month. A stroke can happen to anyone at any time and at any age. But do you know what signs and symptoms to look out for? We sat down with Dr. William Likosky, the medical director of stroke at Community Regional, and he says we can save a life by better understanding the stroke symptoms.
Well, the most important reason why we have Stroke Awareness Month is that stroke is not a good thing. And when people have stroke, it often dramatically changes not only their life, but members of the family. So the awareness is to let people know that there are some fantastic treatment modalities for stroke. One is we have great ways of preventing stroke, and that's probably number one. But if somebody has it, and they call 911 or a family member calls 911, we can often dramatically change what's going to happen to them over the next few years. We use the word FAST, and what FAST means is that often with a stroke, somebody has a asymmetry of the face. Part of the face may not work well. They have a weakness of an arm or leg, sometimes numbness of an arm or leg, and speech is disordered. So very often one can't understand what somebody is saying. And then the T stands for time is brain, and the faster you get treatment, the more likely we are to help you.
How does one prevent getting a stroke?
Well, some of the simple things are, in our valley, for example, we have more stroke than we have on the coast. In fact, we have a great deal more, and it's probably related to a lower educational level, to fewer doctors being available, but it plays out in which people don't treat hypertension. They may not know they have high blood pressure, and if they do have it, very often they neglect it. And that's the number one way of preventing stroke. If you know your blood pressure and it's normal and you treat it, you're dramatically less likely to have stroke. What we're seeing now is more young people because of the methamphetamine epidemic. So not only does methamphetamine, in a sense, destroy the brain and affects the heart, but it also affects the brain and very often causes severe hypertension and stroke. So we see a lot of that in young people. There's also a lot of inherited and developmental abnormalities that young people and older people have too. Well, what we try to do is to say that you can live a life after the stroke. It may be very different, and we hope to prevent the stroke so we don't have to go through this, but we have fantastic rehabilitation services. We have speech therapy, occupational therapy, and then we have medications and medical attention to reduce the risk of another stroke. Many people with one stroke are prone to have another stroke. So one of the big things we try to do is to say one is enough. So if you smoke, stop smoking. If you have a drug habit, let's try to deal with that. If you have difficulty getting medications, let's see how we can get them for you.